Facebook friends, it is Carla, your online doctor, with today's Live in 5. Today is Thursday, June 6th. It is currently 5:01 p.m. So we talked for the last week about natural alternatives to cancer treatment, to the traditional chemotherapy, radiation, and surgery. So again, go back and look at those if those are things you need to know about. Hello, Kim. And go back and check it out because there's a lot of good stuff in there, okay? And a lot of options and things that have a lot of up-and-coming research and things that are proving to be very beneficial. So I wanted to share more information I found about emerging methods for early cancer detection. Clearly, early detection is the next best thing to prevention. Early stage cancers are more easily treated and rarely have metastasized. We are familiar with old school methods of cancer detection, including mammograms, colonoscopy, PET scans, CAT scans, MRI, and ultrasound. Maybe they have some great success, but each, of course, have limitations and risk. So let's dive into these 7 emerging and promising methods of detecting cancer. We're going to talk some today, and we'll finish off tomorrow. So the first one is called the CA profile, okay? Capital C, capital A profile. The test claims to be an early screening test for cancer detection as well as cancer progression. Now, it's developed by Emil Shandel, PhD, MD. This test has 7 components to it. According to Dr. Shandel, this test has been confirmed by biopsy in diagnosed cancer cases between 89 and 97% of the time and can detect pre-cancerous conditions. Hey Marty, how are you? It cannot, however, pinpoint the location of the cancer or identify its stage. But if it's picking it up 89 to 97% of the time, clearly either you know of a family history or you're maybe having symptoms, or you could go on then at that point and get further testing. Now, if more than one of the 7 tests come back positive, it is a strong indication that a real problem exists. A final diagnosis must always be made with a soft tissue biopsy, meaning pathology confirmation. Okay, so may not be a perfect test, but again, if it's a simple test, a blood test, or something that is very simple for picking up these things prior to it being late stages or metastasized, then that's really great. Number 2, early CDT has a lung and liver cancer test. So there's one for each. The lung cancer one measures a panel of autoantibodies, which the company Oncomune claims can be detected up to 4 years before a tumor is visible. That's a long time. The antibodies are against specific tumor-associated proteins or antigens on the surface. Okay, if the autoantibody levels are higher than a set threshold, the test is considered positive and will detect cancers of all stages and earlier and with higher specificity than CAT scans. Now, the test is recommended for current or ex-smokers over 40 years of age with a 1 pack per day smoking history. Now, it's also recommended for people with COPD or a first-degree relative with a history of lung cancer. Okay, so you're already pinpointing the population of people that would be at risk. Okay, it is not recommended for those who personally have had lung cancer due to the possibility of lingering antibodies that could give a false positive test. Okay, the test results are classified as low, moderate, or high. So clearly, high would be the ones that would be the ones most likely to be of concern. Oncomune reports 98% accuracy for people within the target population who get a high result. 98%. That's pretty impressive. Now, they have a liver cancer test as well. It's using specific tumor antigen for liver cancer. The company claims the test can detect liver cancer with high sensitivity up to 4 years before it is detected by CAT scan, MRI, or ultrasound. I mean, 4 years, that's a long period of time for that cancer to get really darn ugly. So guys, if you are at risk for any of these types of cancers so far that we've discussed, look into this, seriously. Number 3 is the AMAS test, offered by Oncolab. It stands for anti-malignant antibody in serum. This test measures the levels of a protein in your blood known as anti-malignant antibody, whose levels rise regardless of the type of cancer or where it is located. During the early part of cancer growth, when the cells are actually rapidly dividing, so it is released by the tumors, so it can be detected in the blood. Now, test results have been shown to be elevated up to 2 years before clinical detection of cancer. This test is controversial, though, because low levels can indicate a variety. It can indicate a lack of cancer. It can indicate an advanced and terminal cancer, which is not rapidly dividing anymore, as well as successfully treated cancer with no evidence of disease. But clearly, it's not just the test, it's in the situation. So if you have already been treated with cancer, and there's no detection of it, then you may be in that category. If you already have cancer and it's late stages, then you understand what's going on. The whole point of this is to be used as a screening option or a detection method. On the positive side, the AMA levels have been found to be normal in up to 96% of cancer patients that are cured. False positives are about 5%. False negatives are about 7%. But there are studies of more than 8,000 breast cancer patients and controls that showed a 95% sensitivity. These are pretty darn good numbers. So these are, again, if you are at risk, you have a strong family history, I would be looking into these. Not that you shouldn't be doing mammograms, CAT scans, all the other things your doctors recommend, because I'm not telling you not to do those. I'm telling you to look into these to possibly pick up your cancers at an earlier stage. Prevention or finding it at an early stage will save your life. So let's continue this talk tomorrow. I have 4, 5, 6, and 7, 4 more tests tomorrow to discuss with you. Who knows? Hopefully some of this information will help. Even if it helps just one person, then I feel like I did a good thing. So hopefully you guys are having an awesome day. I will be back tomorrow for another Live in 5.